and start the recording. We'll get started. We have a few slides to go through. There will be an assessment at the end. There's a link at the end to take the assessment, but we are going to stay on here until at least we get through the questions. Hopefully that will be by 4:30. So thanks again, everyone, for joining us. This presentation really is geared towards preparing case managers to think about how we need to move forward to kind of get back on track along with the state of Indiana for doing our jobs the way that we're supposed to do them as we knew them 6 months ago. There is not a flip that's being switched immediately to say, okay, in the next 10 minutes, you need to set up all your face-to-face meetings for the next week. That's not at all what's happening. What we're having is a conversation with each of our teams to figure out what it looks like to reintroduce the personal, in-person, face-to-face contacts, either visits or home meetings or whatever things that need to be happening, unannounced visits and all those sorts of things. So the first few slides are just kind of referencing the Back on Track Indiana plan. I'm not going to read through all of those things. It's public information. The next slide talks about Appendix K, which is specific to our world of providing services for folks with intellectual and developmental disabilities. There is guidance in the Appendix K that was submitted that indicates that the telemedicine is approved through August 31st, 2020. It's very important to remember that the use of telemedicine, which is what we're doing with our virtual meetings and our Zoom meetings and those sorts of things, that's considered telemedicine. It's important to remember that we can't all just sit around and wait until August 31st to decide, oh, let's start having the conversation about how to get back to our in-person meetings. We need to be having those meetings now about what it might look like for us to get back into the swing of things so that when August 31st hits, we're already perhaps doing some of those in-person meetings already. So one of the things we really have to bear in mind is everything needs to be person-centered. Not everybody is ready for us to come into their home today. So it's very important that we're having the conversations to figure out what it looks like for each individual person on our caseload. Maybe people are ready for us to come sit in their living room or their kitchen or whatever. Maybe people are just ready for us to come sit on their front lawn or meet them at the park or some other type of personal contact. So it's really important as we go through today's conversations that you're not applying the same exact situation to absolutely every person on your caseload. There may be some similarities, but it's not an across-the-board blanket policy that you're doing. The other thing I want to re-emphasize is the importance of documenting what the situation is for each person that you're supporting on your caseload. You need to be putting in your case notes the conversations you're having with people to lay out what the expectation is for reintroducing to in-person, face-to-face sorts of activities. In June, there was some guidance provided by the state that talked about case managers' responsibilities and the meetings and so forth, how we needed to start thinking about those sorts of things. You can read through those on your screen. Basically, we need to be having the conversations about recognizing social distancing, realizing that, again, each situation is in person, but it's not necessarily the same for every exact person. We need to be thinking about if there is, alternate places that we can be meeting, the front porch, a park, a local coffee shop, whatever sorts of places we need to do. If we are providing services in somebody's home, we need to be cognizant of how many things we're touching in a person's house, how many different places that we're going. We need to try to limit the amount of places inside a person's home that we're going so that we're not exposing different areas to us, but also exposing ourselves to different areas as well. The last bullet point on this guidance that is going to be coming out from BEADS here in June is recognizing that there may be some case managers who are not yet able themselves to be a part of in-person meetings. That does not negate the fact that maybe some of the people we're supporting are ready for that in-person human contact. If there's a situation where someone that we're supporting as a case manager is ready for that in-person contact with a case manager, and you yourself are in a situation whereby you're not able to provide that, then we need to be having conversations with our supervisor and our administrative staff to figure out what does that look like? How do we as a company need to support you as a case manager to make sure your individuals are receiving the support that they need? So as you're thinking about personally being the one to meet individually with individuals, there are three kinds of questions that you need to be bearing in mind. Have you had any close contact with someone who's tested positive within the past 14 days? Are you currently ill? Do you have symptoms of a cold, cough, shortness of breath? Have you temporarily lost your sense of taste or smell? Do you currently have a fever, or have you had a fever within the past week? These are things you need to be thinking about for yourself, but also those are questions you should be asking of the individuals that are going to be joining you in those in-person sessions, whether it's the individual or the guardian, family members, whomever. Those are important factors to determine, if it's right to move forward with having those in-person meetings. And if you choose to, as a group, not to continue to meet in person, that's perfectly fine. You just need to document that in your case notes to reflect, hey, we had a conversation, because, the mom has, had contact in her job as a nurse with patients that have COVID for the past 14 days, we decided not to meet in person. Just record that in your case notes so it's clear what's going on in the situation. There's more information in here about referring people to the guidance from the CDC website. There's some links later in these presentation slides that have the actual link to the CDC website for some additional guidance if you guys would like that. All right, so let's talk about personal protective equipment. We as a company will be providing all of our staff members with some of the personal protective equipment that you might request to have as we're thinking about going back into in-person types of contacts. So at our company picnic on the 8th of July, we will be distributing face masks, face shields, hand sanitizer, refillable bottles and pumps and such to do your own refills of your pocket-sized bottles of the sanitizer and those sorts of things. If you are unable to attend the picnic, we will be doing basically a roadshow, a driving tour of delivering these items. There's a pretty sizable package that has these materials in it. That what we will likely do is make one stop in different towns, and those of you that are, kind of around the Fort Wayne area or whatever, will have a central meeting spot so everyone can come and pick up their packet if they weren't able to pick it up at the picnic. Some things to think through as you are thinking about where you might choose to have an in-person meeting. Some of these things we already kind of talked about, looking for locations to meet that are outside, weather permitting, of course. We're not asking you to sit outside in the rain. Consider using your personal protective equipment, recognizing social distancing with sitting 6 feet apart, looking at the number of people within your group size. If you've got a team that has 12 people on it, is it really necessary for all 12 people to come sit around the picnic table, or can a few of you join by conference call or FaceTime or something? Make sure that you're not touching your eyes and nose. Make sure you're washing your hand or using your hand sanitizer. Make sure that you're not sharing common items. If you're needing to get signatures and those sorts of things, think through how you might need to modify your practices in terms of sanitizing people's hands and such as they're signing a document or holding an ink pen or those sorts of things, if you're sharing all the same ink pen or those sorts of things. Think about sanitizing those items that you're commonly using. If you're going to a location where there happens to be visitor guidelines, we need to be respectful of guidelines that have been established by organizations. We also need to remember that we need to be person-centered. So if there's a blanket policy that a company has related to absolutely no visitors at all within 500 feet of the house or whatever, some of that needs to kind of be looked at in a more person-centered way. There's got to be some ways to be able to have some on the porch conversations or in the front yard conversations where you're not having to go into the premises or touch the doorknobs or those sorts of things. As always, we need to be making sure that we're covering our sneezes and coughs and just recognizing appropriate etiquette. Some other things are making sure we're drinking plenty of fluids, eating healthy, managing your stress. I know that's a little tricky right now to kind of be thinking about, but so talking about coordinating with other team members if there's tasks that need to be accomplished. One of the things that I can come to think of is there's sometimes that we need to get signature pages signed, and we've utilized some of the other team members to figure out how to make that happen. So some of maybe the behavior specialist, or they're printed off signature pages to a family that doesn't have internet to be able to print or something like that. So think through some of those options to be a little bit more creative about getting things done that need to get done, but utilizing other team members to help get things accomplished. As always, if you're sick, stay at home. Make sure you're having conversations with your supervisor if you're missing meetings. Again, if you can't be there in person, perhaps there's somebody else that works for us that can fill those roles for you. If you're aware of somebody on the team that is sick as well, whether that's the individual or the guardian, make sure that you're canceling the meeting or postponing it or whatever, so that you're maintaining the respect that everyone needs in these tricky times. All right, so we're going to watch a couple of videos to kind of go through some of the steps that we need to remember as we're reintroducing ourselves to our face-to-face required responsibilities. So we're going to hope these launch on here.
Hey, Joy, there's no sound coming through on the video. I'm not sure what's going on.
Alrighty. Aren't you able to do the links off of yours just by clicking the link in the slide? When you do these like this, Amy?
I don't have the presentation up. Let me see if I'll pull it up real quick.
Did the second time I ran it, did the sound come through? Okay.
There
All
was
right.
no sound.
So,
You could, if you want to try and make me presenter, I'll see if I can show it from my side. Okay, let me turn up my volume. Let's see if this works.
The virus that causes coronavirus disease is
Okay, did everybody hear that?
yes,
You can
we're
raise your.
good.
Okay, so I'll go ahead and continue.
spreading in some of our communities. This disease, also known as COVID-19, is thought to spread mainly from person to person through respiratory droplets produced when an infected person coughs or sneezes. These droplets can spread to the mouth, nose, or hands of people who are nearby, or possibly be inhaled into the lungs. Take steps to lower your risk of getting sick. Here are some things you should do. Wash your hands often with soap and water for at least 20 seconds. You can also use hand sanitizer that contains at least 60% alcohol. Take extra measures to put distance between yourself and others. Avoid close contact with people who are sick. Stay home if you're sick, except to get medical care. If you have severe symptoms, please call 911. Cover coughs and sneezes with a tissue or the inside of your elbow. Only wear a face mask if you're sick and around other people, or if you need to take care of someone who is sick. Clean and disinfect frequently touched surfaces. Older adults and people who have severe chronic medical conditions like heart or lung disease or diabetes are at higher risk for more serious illness from COVID-19. This group should consult with their healthcare provider about additional steps to stay protected. For more information on COVID-19, please visit cdc.gov/COVID-19. Let's work together to protect ourselves, our families, and our communities.
Amy, you can go ahead with this next slides and just click the links in the slides.
Okay, let me get back to. Let's see. Where is that? Okay, the next slide.
Hand washing is one of the most important ways you can keep from getting sick and spreading germs to others. Dirty hands spread disease. This hand washing demonstration will show you how hand washing can get rid of germs and chemicals that get on our hands every day. This gel is like the germs and chemicals that we get from things we touch throughout the day, like our toys and pets. If we then rub our eyes, nose, or mouth, or pick up something to eat, the germs or chemicals can get into our bodies and make us sick. Studies have shown that people touch their eyes, nose, and mouth about 25 times every hour without even realizing it. To get rid of these germs and chemicals, CDC recommends you follow these easy steps every time you wash your hands. Wet, lather, scrub, rinse, and dry. We're going to show you the right way to do each step. First, wet your hands with clean running water. Turn off the tap and apply soap. Then, lather your hands by rubbing them together with the soap. Be sure to lather the backs of your hands, between your fingers, and under your nails. Scrub your hands for at least 20 seconds. If you don't have a clock nearby, keep scrubbing until you've sung the happy birthday song twice. Rinse your hands well under clean running water. Dry your hands using a clean towel, electric hand dryer, or air dryer. Washing your hands using the steps we just demonstrated is very important to get hands completely clean. Let's see how well we got rid of the germs and chemicals. Great. No more germs and chemicals. Why is this so important? Germs and chemicals from unwashed hands can get into our foods and drinks when they're being prepared or when we're eating or drinking them, which can make us sick. Also, germs and chemicals from unwashed hands can be transferred to other objects like cell phones, tabletops, or toys, and then transferred to other people's hands. That's why it's so important to wash your hands following these steps. Wet, lather, scrub, rinse, and dry, so you can stay healthy and help keep those around you healthy. For more information, visit cdc.gov/hand washing.
Okay.
Hi, I'm Jennifer Sorensen. I'm a registered nurse in our education department at Sarasota Memorial Hospital. Sarasota Memorial Hospital is adapting masking guidelines to care for our patients and protect our employees as well as the community. As many of you in the community are choosing to wear masks, we want to ensure that you are wearing them properly. Here are some important tips while wearing your mask. Never touch the outside of your mask while your mask is on your face. The mask on the outside is considered dirty. Don't pull your mask below your chin while you're wearing it and have it sitting down here. It should always be fitting properly on your face. Third thing, you don't want to have the mask dangling. You don't want it sitting like this. All of these are going to create opportunities for cross-contamination of yourself or other surfaces. I want to cover a few simple steps to keep yourself and others safe while wearing your mask. When you first go ahead and pull out a mask, we want to make sure we identify which side of the mask is the outside of the mask, because the outside of the mask, again, is dirty. Here at the hospital, we're marking the outside of the mask with our initials. For you at home, you may choose to do the same, or you could put something like a star, some type of mark identifying that that's the outside of your mask, because you can see it's the same color on both sides. So that's going to identify that that's the outside of our mask. The second thing, whenever we're taking our mask off, we want to make sure it's put into some clean type of area. We want to store it in a clean area. Here at the hospital, we're using a paper bag. At home, you could use a paper bag as well, or you might choose to use something like a Ziploc baggie. What we don't want to do is put it in an area that's not clean. An area that's not clean would be something like our purse or our pocket. So I am going to go ahead and put my mask on. So to put my mask on, I want to pull it down, make sure it's covering under my chin, make sure it's covering my nose, and make sure it's on nice and secure. So again, I'm not going to touch the outside. I'm not going to pull it below my chin, okay? I need to now remove my mask for whatever reason. First thing I'm going to do is clean my hands. So I'm going to perform hand hygiene. I can do that with soap and water or hand sanitizer. When I remove my mask, I'm going to do that from a clean area. So I'm going to remove my mask from the ear loops. I want to inspect this mask to make sure I can reuse it. So has my mask been compromised at all? Is it wet? Is it visibly soiled? If it is, I want to go ahead and I want to throw it away. I would then go ahead and perform hand hygiene, wash my hands with soap and water, or again, using my hand sanitizer. If it's okay to reuse, I'm going to go ahead and I'm going to fold over my mask. I'm going to fold it in half and folding it so the outside surfaces are touching each other. And I'm going to place it carefully into my clean storage. If it's a paper bag, I want to seal it over, so fold it over. If it's a Ziploc bag, I would go ahead and seal my Ziploc bag. Perform hand hygiene, because I still touched probably some edge of my mask that was potentially dirty. And now it's in a nice clean area. To reapply my mask, okay? So to reapply, I would probably wash my hands first, perform that hand hygiene, open up my bag. When I first go to grasp it, I want to grasp it from the ear loops. I want to look to find where is the outside of my mask? Where are those initials? Where is that mark? Because that's the outside. Putting it on by the ear loops. Okay. And trying to use the ear loops to kind of get it tucked under my chin. And then you're going to kind of need to secure it to your face. So you are touching the outside of the mask for a second. So then again, I'm going to perform hand hygiene. Wash my hands with soap and water, or again, use my hand sanitizer. And I'm ready to go. For the employees at the hospital, at the end of your shift, at the end of the day, you would remove your mask and you're going to throw it away at the end of your shift. Those are our tips for ensuring that you are utilizing proper masking guidelines. Thank you so much. Stay safe and stay healthy.
Oh, okay, it's an ad. Sorry, I was a little
We'll skip the
confused.
ad.
Yeah.
How do you disinfect your mask, and how often should you do it? Well, for any kind of cloth, you can actually just throw it right in the washing machine. It's thought the warmer the water, the better, but honestly, the temperature may be less of a factor than just the simple fact that it's the soap that is dismantling the virus and washing it down the drain. It's for that reason steaming isn't thought to be as reliable. Maybe you miss a spot, or you just never get the cloth hot enough for long enough to reliably kill the virus. Another thing to keep in mind, not all homemade masks are made equal. So if you have any concerns about throwing it into a washing machine, you can always throw it in a delicates bag just to be safe, or you can wash it by hand. You just have to make sure to do a really thorough job. You want to wash it as if you know there's coronavirus on it. As for how often you wash your mask, well, ideally, it's after every use. So just imagine in a doctor's context, that would be after every patient. But for you and me, think of it as after every outing. So you come home, you wash your hands, you wash your mask. Now, one last thing about medical grade masks. Considering they're in short supply, they're not for your use, and they're not designed for reuse either. Disinfecting them could damage them, so don't try it at home.
Okay, when did that one start? Hush.
Scroll down a little bit. Actually middle, right there.
Social distancing is a tool public health officials can use to slow the spread of a disease that is being passed from person to person. The CDC describes social distancing as staying away from mass gatherings and keeping a distance of 6 feet or 2 meters from other people. At the moment, this is one of the most important tools available to fight the spread of the coronavirus. Experts estimate that a vaccine is 12 to 18 months away. Some examples of social distancing are closing schools, closing theaters, and working from home. But social distancing also means not touching other people, and that includes handshakes. The goal is to keep the number of cases at any one time below the capacity of the healthcare system. This is what people mean when they say social distancing can flatten the curve. Why does social distancing work? If done correctly and on a large scale, social distancing breaks or slows the chain of transmission from person to person.
This flattens the curve so that the medical care system is not overwhelmed. People can spread the coronavirus for at least 5 days before they show symptoms. It's very important to take the possibility of exposure seriously and quarantine yourself if you think you are exposed. Self-quarantine should last 14 days. This covers the period of time during which a person could reasonably present with symptoms of COVID-19, the disease caused by the new coronavirus. Frail older folks are most at risk and should be doing all they can to protect themselves. But younger, healthier people can help here too, by minimizing their own exposure to the coronavirus and thereby reducing the chance they spread it to someone older. There is also likely a subgroup of otherwise healthy younger people who, if they got the coronavirus, could get very sick. So right now, whoever you are, social distancing is critically important. It is one of the most important tools we have to fight this pandemic. Much of how it unfolds in the US will come down to the choices people make.
Okay, I think that's the end of the
Yep.
slides. I sent the link for the assessment in the actual comments of the questions and answers. So if people want to click on there, you're welcome to do that. These slides and the recording will be available as well after the call, so that if you wanted to go back and reference any of the slides, you can click on the hyperlink in the slides as well. So we're going to go ahead and get started with the questions and answers that are starting to roll in. So one of the questions that has come in is related to how, as long as we discuss what consumer and family wants, are we able to start meeting in person with people in July? My understanding is there is no meetings for in person during the month of June. So I started replying. Basically, the state never told us to stop meeting in person. We as a company implemented guidance to our staff to say, hey, it's okay to utilize the telemedicine option by doing the virtual meetings. That's one of the flexibilities that was outlined in Appendix K that was submitted to the federal government and just actually recently got approved. That was our guidance as a company that said, hey, let's hold off on doing meetings in person. So if you have materials that you feel comfortable moving forward in conducting visits and meetings in person, you know, if you feel like you need to wear a mask and you need to, you know, have a face shield or whatever it is that you feel like you need to have, if you have those materials before July 8th, then you can move forward with proceeding with your in-person tasks. If you want to wait until you have those materials, then yes, you will have those at the picnic on the 8th of July. Or if you're not attending the picnic, then they will be made available to you shortly thereafter, as soon as I can get to all the places around the state that need to have meeting points for me to deliver those things. Okay, sorry, the questions are jumping here. Let me get down. Have an unannounced visit due. If I do a visit where I am outside the home but able to see the person inside, will this count? Would it be possible for your person to come outside the front door so that you could have a conversation with them? Part of the unannounced visit is that you're observing that the person seems to be in good health and that you're actually having a conversation with them to talk about, you know, do you feel safe? Are your staff treating you well? Those sorts of things. And so even if you're not able to go in and make sure they've got food or, you know, check to make sure they're not living in filth or whatever, at least be able to get as much of a in-person contact that you can. That might also be a situation where you might feel like you might want to go back and do another unannounced visit, you know, in 6 months or something, when you feel a little more comfortable and the family feels a little more comfortable with you entering their home. Can we be at the home and have team participate by virtual meeting to make sure there is a 6-foot distance Would this meet our expectations? Yes, that's part of what I was saying about being part of a team discussion about what needs to be in place for the team to feel good about having a meeting in person. So part of that may be some of you are there in person and some of you are participating by phone or by Zoom meeting or whatever. So yes, just talk with the team about what the plan is for that specific individual and make a note of that in your case notes. And that will be something that you'll want to revisit. You know, that's not the be all end all answer necessarily forever and all time about how that team's going to meet. It's just how are we going to meet the next time we get together or when we're needing to have another meeting. Can providers continue to restrict visitors? How should this topic be approached for providers who may be resistant to this? Great question. Businesses of all sorts need to have policies in place to protect their own employees and the people that they are serving within their business operation. So if you think about Menards, they have a policy that anyone coming to shop in their store has to wear a mask. If you're someone that doesn't want to wear a mask, then maybe you just need to reconsider, you know, do I really need to buy what I need to buy at Menards, or could I pick that up at Walmart or Lowe's or another store? Likewise, businesses like Logan or Easter Sales Arc or whatever organization it is, they have policies in place to implement for the safety of their own employees, as well as the people that are coming and going from their place of business. So we can't tell them their policies are irrelevant and just storm in and take over and just say, you know, well, it's okay for me to be here. We have to follow their policies, but at the same time, we also have to be cognizant of each person's situation needs to be looked at in a person-centered way. And so if you have an individual that happens to be going to day services at, say, Logan, and Logan says, hey, we're not letting any case managers in, we don't need to storm in and say you're all wrong. We just need to talk with the team about, okay, we want to respect your policies. How can I still have an in-person contact with my individual if that's what the individual wants? If the individual is saying, no, please wait, you know, please wait another month or so and then come visit me at my house. Every situation is going to be different. So please have that individual conversation with each of your teams to figure out what's going to be the person-centered way that each individual you're supporting is going to be having your next meeting. I can try to have conversation with person, but he is limited verbally. That's true. So if they have a guardian or someone that is speaking on their behalf, a trusted staff person that they know well, whoever you're normally talking with to gain insight on what the preferences of that individual are, that's who you'd be speaking with. And as a team, you're making a decision how you're going to meet the next time you have a meeting. How do we handle a situation if an individual or guardian does not want to wear a mask? Well, we can't force people to do much of anything, really. So if someone is choosing not to wear a mask, then there needs to be some team discussion about what types of things that they can be involved in. Like the situation I mentioned a bit ago, you know, he's probably not going to go shopping at Menards because Menards as a business requires that a person wears a mask. If Logan or Easter Sales Arc or whoever as an organization is implementing policies for their organization that if someone's going to come to work there or come visit there, they have to wear a mask, then that's something that has to be in place for that person to go. And if they're choosing not to do it, then they're not going to be able to go. And so the team's going to need to figure out, okay, well, for the time being, if it's going to be a requirement that every person that enters this building wears a mask, then he's probably not going to be going there. Maybe they need to talk about other services. What does that look like for still getting services at home? Or is there another day service provider or business or wherever, something else for him to do during the day whereby he would not need to wear a mask? Maybe there's other services within the same business. You know, maybe he's currently going to day services in a building. Maybe there's, you know, some community-based services that he could participate that are still overseen by Logan, whereby maybe they're, I don't know, going for walks in the park where they wouldn't necessarily have to wear a mask, or there just needs to be some creativity by the team to figure out, okay, if our individual isn't going to understand the social distancing and the need for protective equipment, what does that look like moving forward within the context of the services that he needs to support him? Is there a deadline we are putting in place to have all overdue unannounced visits, or at least attempted and documented by? Currently, we're still operating under a lot of flexibility with this. For the unannounced visits, there needs to be some efforts made. I'm not necessarily putting a hard and fast deadline on this because every situation is different. There should be some record in the case notes to indicate what's going on in a situation. If I can clearly see when I'm looking at the case notes that the case manager has had the conversation with the team's not comfortable having in-person visitors or those sorts of things, then of course I'm going to understand why there isn't an unannounced visit, because it doesn't make sense for somebody to go do an unannounced visit if it's very clear that the team has said, let's wait another month or so, let's revisit this conversation about visitors or in-person meetings or those types of things. So for the time being, I would say probably for the next couple of months, just make sure you've got your case notes supporting, if there's something that's still outstanding, it's clear in your case notes why it's that way. Can the link for the assessment be emailed? It won't let me click the link or copy and paste it from the question answer thread. Sure, yeah, we'll make the slides available that have all of the links in it. Those will be available right after the session. Are there other questions? I don't want to hold you guys hostage forever. We are done a few minutes early, so if there aren't other questions, then we can close it out, but I don't want to shut it down immediately in case somebody's writing a really long question. So we'll hang out here just for a little bit longer, and then those of you that want to go take the assessment, you're welcome to do that. We do need to have the assessments completed by the end of June. This training session is part of our business plan that the governor requires of all Hoosier businesses. So I need to have documentation from all of our staff that we have conducted this training. And I realized that some of the videos were maybe kind of reminders and not necessarily new information, but it's good information to have available. Are there good suggestions for cleaning electronics such as tablets used for signing documents? There are wipes that are available for electronics. You just have to be really careful because some of the wipes, they're not sanitizing, they're more like dust cleaning, which is probably better than nothing. But in terms of like using a Clorox wipe on your electronics, I really caution you not to do that because that really messes up the display on your screen.
And there are some electronic wipes that have alcohol in them. So you might want to look for those. Alcohol 7030 is isopropyl alcohol 7030 is an electronics cleaner. So, and it's a very quick drying, so you can use that.
Thanks. There's a few more questions that popped in here, so I'm going to address these. So from this day forward, we can do as needed for every team and can have face-to-face meetings. Just double checking. Sorry if it's already answered. Yes, you can have face-to-face meetings. Please just make sure that you are prepared for whatever that looks like. So if you have a team that you call tomorrow that wants to meet next week, and they want to make sure that you show up with a face mask and, you know, whatever all else, if you don't have a face mask, then you might want to delay the meeting until you get your face mask at the picnic. If you happen to have a face mask and you've got what the team is looking for that team to meet, then yes, please proceed with having your meeting as you would normally have it. If family is not comfortable having team meeting in their home, how long is virtual meeting permissible? Well, I guess my question would be, if they're not comfortable having it in their home, would they be open to having it at a coffee shop or at the day service place? You know, it doesn't have to be in their home. I assume maybe the only services this family might be getting might be in their home. But again, would they be open to having the meeting at a coffee shop or on their front porch? You know, in their front yard, you could all sit around in lawn chairs. You know, there's some options you can have. Don't feel like you have to have it inside the four walls sitting at their kitchen table. At the moment, the flexibilities for virtual meetings are going to end August 31st, but we have to be very clear as a company that we're not hearing me say August 31st and assuming that, oh, well, I'm just going to not worry about anything. I'm not going to even start having conversations about what the plan to meet in person looks like. We need to be having the conversations now and not assume that our entire caseload can just wait until August 31st and not even think about it. There is a pocket soap, which are, there is the pocket soap, which are electronic, but this is expensive. Okay, I'm not sure what product specifically they're referencing. So if they happen to have like a brand name or something, we'd be happy to share that with everybody if they'd like to include that. Yes, the sanitizing versus cleaning is tough to determine. No, family is not leaving the home. Okay, but still, would the front porch or the front lawn work? And yes, if they're not leaving, it's totally fine. That's not what I'm saying. I'm just saying, just be cautious about applying the same principle to your entire caseload. Just document in your case notes that, you know, if you've got a meeting that's due in June, just start having the conversation about what they would be looking for the next time they get together, what would need to be in place for them to meet. And maybe, you know, when you meet in September, maybe they're still kind of finishing up their, hey, let's still do one more virtual and then we'll do a face-to-face or whatever. There just needs to be clear documentation in your case note about what the team's conversation related to coming back to that face-to-face. What does that look like? If an individual may be considered high risk but wants to have face-to-face meetings and is emancipated, can the team decide that face-to-face may not be in that person's best interest until absolutely necessary? Well, we are supposed to be person-centered. So if the person is asking for face-to-face meetings, again, are there some accommodations that could be, some compromises that could be made? You know, if the person wants to meet with people, you know, again, could it be on the front porch? Could it be in the front yard? Could it be at a coffee shop? It's still a more personal contact that might be helpful for the individual, but still recognize some of the concerns that the team has about their high risk needs. This is an electronic sanitizer which you can put the tablet in and it sanitizes it. This is somewhat expensive as this is an electronic device. They are using some of these in the hospital. Okay, I do remember seeing, I think it was on the news, there was an article that there's like a little box that you can put like your phone or your tablet in and you shut the lid on the box and then it does its thing and voila, it's now sanitized or something. What I thought I heard them say on that news article is that they're not for They're not selling them publicly on the market, and so they're not available to be purchased like by the general public. If hospitals are using them, that's great. I don't know where they're getting them. So, I mean, if that's something that people want to look into purchasing, I mean, that's probably something that could be considered. For me, I would probably use some of the more readily available items that we have for sanitizing things. I've used sanitizer on my computer screen and keyboard without any issues. The hand sanitizer. Okay, thank you. The company name for that electronic sanitizing box is Phone Soap. I'm going to make a note of that so I can go look that up. When I heard the news article, it said it wasn't available to be purchased. I kind of just shut my ears off. Okay, great questions, guys. Do you have any other questions that we can make sure we answer? We'll give it just a couple more minutes here in case somebody's writing a really long question. Somebody suggested I buy spray sanitizer and spray laptop, pen, and phone after meetings. Great suggestion.
I also keep disinfecting wipes in my car so that I can wipe things down too after meetings. And I've done this just anyway, but I have always asked teams to provide their own pens whenever possible. But yeah, keep stuff in your car that you can use to sanitize.
Where are you getting disinfecting wipes, as I have not seen these for a while at the store?
I had managed to get some very, very early on. And so I still have mine. I was lucky. I was at Sam's Club and managed to pick up like a 5-pack before right when all this. I know. I was very, very fortunate to get my hands on them. But I've kept them in my car and I use them even like when I go somewhere, like I'll sanitize my credit card, or like I use them on the gas pumps. And yeah, it's, and Samantha says Family Dollar evidently has them. And Sarah said she has made Lysol and Clorox wipes. So
I saw some at the Dollar Tree in Goshen yesterday. They were at the checkout. They had a big sign on them that they were limiting one pack per customer, but at least you could get them. I guess you could run through the checkout a few times maybe. Somebody suggested they keep their hand sanitizer in the purse at all times, and
yep.
That booger is in my hands the minute I walk out of anywhere. I made my own hand wipes with Lysol and paper towels. Sprayed them all down very well and put them in a Ziploc bag. Meyer seems to be doing a good job of keeping wipes in stock. Still seeing some wet wipes at the store, or using the Windex wipes. The Kroger in Plymouth, I assume, had some. ShopRite in Orland, 1 per customer. Do not leave your sanitizer in the car, as these have seemed to have issues with catching on fire in hot weather. Well, that's good to know, but if we're carrying it in our purse or our bag, that our handy dandy Advocacy Links bag into our meeting or whatever. But I also recognize you probably want to be cautious about how many different items you're taking into meetings. So, you know, slip your pocket one into your pocket. South Bend and Mishawaka are like a desert when it comes to any form of disinfectant. If you happen to be in Goshen or Elkhart, it sounds like there are a few places in those areas, or maybe ask a colleague to pick you up some. Road trip to Plymouth Kroger's. Okay, guys, these are great suggestions. Thanks for weighing in on that. Well, apparently only one of our employees knows where the secret stash is at the Plymouth Kroger's. They have small ones you can hang off of your purse or bag. Not sure if those are the wipes or if that's the hand sanitizer. I have the small hand sanitizer that hangs off my purse or bag, but I don't know that I've seen the wipes. Okay, guys, great suggestions. Thanks again for your participation today. I'll get the link sent out with the slides here immediately after the call so you have it fresh in your head. Thanks again for being on the live version and asking the questions for the ones that need to listen to it later so that they have some common questions that you guys would have already asked. All right, guys, have a good rest of the afternoon.